So here we move to another module, mainly regarding the milk. The first topic on that is how we can test the raw milk and how we can grade them into different categories. So coming to that, the importance of testing and grading of raw milk is that it is a process for ensuring the safety as well as quality of milk. So when we are selling a milk, we have to make sure that the product, the milk product, is safe and is of good quality. That safety and quality are to be ensured by this process of So that is the importance of testing and grading of milk. We have to primarily ensure the quality of the milk. And there are a number of tests for that. We will be seeing what are the physical tests, chemical tests, and what are the bacteriological or microbiological tests. And based on the grade, we are determining the price of the product also. That is the fundamental idea in testing of milk. So what are the objectives of milk testing? We have to see that the primary objective is that to ensure that raw milk meets safety and quality standard. The standard put by Kerala government and may be different from standard put by Tamil Nadu government. It may be different from the standard of central government. And if we are exporting that milk to some other country, we have to meet the standards put forward by that country also. So every country will be having their own standards in this. Then to detect adulteration and contamination. Everybody knows that people will be adding water to the milk. So that is a common practice. So if it has been there for a long time. So there should be some mechanism by which we will be able to detect how much water is there. And then to determine the price based on quality parameters. So quality of the milk, maybe how much amount of fat, how much amount of protein. All these should be checked properly to provide feedback to the producer for improvement. That is also an aim of that, to classify milk products into various categories. For example, sometimes we might be hearing a low fat milk, high fat milk, rich milk. Rich milk means the fat has not been removed. So even the Milma is selling different types of milk, low fat milk like that. So that is the category grading. So milk is tested based on sensory, physico-chemical, microbiological and adulteration related characteristics. So here we will be looking into that. So the first one is a sensory examination. That what we can do with our eye or with our other difference like taste or smell, etc. So this is conducted immediately after the milk is received. So for example, from appearance alone, so we can say that the milk should be uniform white or creamy white. That is one important thing about the quality of the milk, without any kind of discoloration. Even a slight discoloration may be indicating that milk may be contaminated or milk may not be fresh. All this can be, for example, for an expert person who is usually dealing with the milk, they can immediately sense that this milk is not of proper quality. Then second is the odor and taste. Should have a clean, pleasant smell. For example, a freshly collected milk. The smell of that milk will be different from a milk that has been kept for several hours. So that smell and the appearance, the taste can tell a lot of things. So these are the things which we will be able to tell by without any kind of equipment or any kind of instrument. With our sense organs itself we can tell. Not any bad smell or sourness. Sourness may indicate that milk has been spoiled. The lactic acid might have developed in that. The parameters for silk testing: free from lumps, sediments and curdling. So these are some of the important features which we can examine by means of our sensory examination. Then next coming to the more scientific test, which are physico-chemical tests. One is temperature. The milk should be kept below 4 degrees centigrade during transport and storage to inhibit microbial growth. So there won't be much bacteria developing or bacteria living at a temperature lower than 4 degrees. That is why our refrigerators are all working on that principle. You can see that in modern refrigerator there is a temperature indicator. In some, not all, but if you buy a little more advanced one, most of the time they will be showing some temperature, and you can see the temperature may be 4 degree, 3 degree, and some refrigerator usually have a freezer unit where we can lower the temperature up to -17 even. So a second aspect is the fat content determined by Gerber method or butyrometer. This is the way by which we will be able to dictate how much. Usually the fat content is between 3.5 to 5. That is the amount of fat that is normally present. This indicates richness of milk. So the milk is full of it is having the normal amount of fat, we call normally as a rich milk. So rich cream milk used in grading and payment. So depending on the amount of fat, we will be able to grade the milk on that. Then solid not fat, SNF, solids not fat, calculated using lactometer reading or electronic milk analyzers are there. I will show, we don't have, it's a very simple thing. Lactometer, I will show you a picture of a lactometer. Lactometer is a very simple one. Even in Amazon you can see such kind of apparatus. See, this is a very simple device. So you can see this is how we just put the lactometer into it, so that we can get an idea of how much amount of water is present in that. So that is the lactometer. It's a very simple instrument. I think even in Amazon it is available. I'll show you in Amazon. See here also you can see it's not very expensive also. These are all lactometers. You can see that. See, only 200 rupees only. So it's a very simple device, and that will show how if water is there, that will be indicating. So that is the idea regarding the testing for. So calculated using lactometer based on or electronic meters are there. The solid not fat will be including lactose, proteins and minerals. That is what are the contents which are usually dictated by lactometer. Then density is also measured using lactometer. Normal range of the milk should be 1.028 to 1.0. That is, the density of the milk is slightly heavier than density of the water. So that if you are pouring water should be above the milk. That is the practical implication of that. Low value may suggest water adulteration. So if this value is less than this amount, it shows that water has been added disproportionately. So that is one way by which we will be able to tell how much amount of water has been added. The next one is the acidity test. That will be measuring the lactic acid content. A normal range of 0.14 to 0.17. That is the normal amount of lactic acid usually present. Higher acidity indicates microbial activity, and when the amount of acid in the milk is increasing, the taste of the milk will become more sour, more acidic. Slight sourness will be there, and that indicates that microorganism or bacteria has been multiplying in the milk. Then another indicator is the pH. The fresh milk has a pH of 6.6 to 6.8, slightly lower than the normal pH. Then another is alcohol test. It should be it is done to check the heat stability of the milk. The curdling on adding 68% alcohol indicates poor stability. So by adding a little bit alcohol, we will be able to tell what is the heat stability of the alcohol or heat stability of the milk. That is another test called the stability test. Then freezing point test dictates added water. Normal range is 0.53 to 0.55 degrees centigrade. So here you can see that all these tests are basically physical tests. Then there will be some microbiological test also. Regarding the microbiological test, that will be measuring the total number of viable bacteria. So that is a total plate count, TPC. It indicates the general hygiene and handling. That is, milk has been taken from the udder of the cow, and it should be collected by after washing hands. The collection procedure should be very proper. If they have some disease, there is high possibility that from the hand of the person, the bacteria can reach the milk, and that also can reach the person who is drinking it. So that is a problem why it should be collected by ensuring proper hygiene, especially hand hygiene, and also the person should be free of any kind of disease also. Then another is coliform count, indicates fecal contamination and hygiene at milking point. So that is also another if the farms are not properly cleaned, there is a possibility that fecal bacteria like E. coli can develop there, and E. coli contamination indicates that some kind of fecal matter has entered or fecal contamination has taken place. Then somatic cell count. High somatic cell count is a marker for mastitis. Normally it is an infection of the breast of the or nipple of the cow. So it is a common disease affecting cows. So that is indication of mastitis, a kind of udder infection. Then Rosium or methylene blue reduction test. That is used to estimate bacterial load based on oxygen consumption. Methylene blue is a chemical used for that. A quick simple test, faster color change indicates higher microbiological. So this is a test. All these tests can be conducted in our lab also. Then adulteration test. What are the common type of adulteration tests which are used? Milk is commonly adulterated water, starch, urea, detergent. Water is added to increase the volume. So if there is 1 liter of milk, if you are able to sell it as 1.5 liter, you are getting more money. So that is a common practice. And what we can dictate using freezing point depression. That is the test used for dictating water. Then starch is there by adding iodine if somebody has added, so that even if you are adding water, the milk will appear very thick. That is the purpose of adding starch. But if you by doing some kind of iodine test, we will be able to tell whether starch has been added. Only if the starch is there, the milk will turn the blue color. The next one is the urea. In case of urea, we are using DMAB, dimethyl amino benzyl aldehyde. Dimethyl amino benzyl aldehyde. That is a test used for that. So when urea will be reacting with the DMAB, that is one way. Then detergent, sometimes leather test or bromocresol purple paper, that will be added to the. So these are the tests used for detecting the presence of detergent. Then we have neutralizers that can be detected using rosalic acid. So these are the different type of tests used for detecting adulteration. Now here you can see how milk can be graded. Grade A, grade B, grade C. So here here also you can see that what are the important values. And so here you can see that there are different types of milk, grade A, grade B and grade C. So that is, these are the important values on the basis of which we are classifying the milk. Then next one is the sampling and handling protocols, how we can collect the milk. So that is some area. So one is sterile technique should be, because earlier I told you the hands of the patient and the patient should be also free of all sorts of diseases. Otherwise, there is every possibility that microorganism can enter the milk. So one is representative sampling, proper mixing before sampling ensure accurate testing. So that is one way by which we are checking. That is, we will not be going to test all the milk. Entire milk we cannot test. We will be taking a small sample from the milk and we will test for the presence of bacteria. Then labeling, each sample should be labeled with the time, date, farm and batch number. Why farm number is given? Nowadays when we are selling some product to other countries, even the farm from which it is produced, that should be mentioned, because that there is one important thing in export, traceability. When one product has gone damaged or spoiled, they will be checking from which farm that product came, and that is also traceability. Now it is getting more and more important, because if one particular farm is continuously selling that kind of product, they will blacklist that farm. So this kind of thing is there. Then preservation, use ice box or preservatives like potassium dichromate for long distance transportation. So a little bit potassium dichromate, if you are transporting from maybe from Tamil Nadu, they are selling to Kashmir, it takes 1 or 2 days. So that way we have to make sure that proper preservation has to be done. Then what are the equipment and technologies which are used for that? One is milk analyzer, that will be measuring the amount of fat, solid not fat will be checked. Then protein will be checked, density of the and water content will be also checked. So these are some of the instruments used for that. We have also electronic somatic cell counter, PCR, ELISA. So the purpose of that, they will be able to detect the presence of pathogen. Then there are number of international standards here, like Codex Alimentarius, ISO standard, national standard like food safety standard, other. Now FSSA is getting more and more popular. If you want to sell some product, we have to get the certification from that. Now you know that the sugar, the coconut oil, the earlier the price of coconut oil was around 250, less than 250. Now it is going to about 450, because the FSSA has increased the checking. So then USA, they have grade A pasteurized milk ordinance are there. The EU regulations are there. So these are the different types of standards which we have to meet while exporting the milk. Then these are also the role of the dairy cooperative and dairy plants are there. They will be giving the proper care, so that proper incentive should be given to the farmer for producing better quality milk, and how the farmer should be trained. So these are, that is why MILMA and PDD, they play an important role. So if they want good quality milk, the farmer from which they are collecting the milk should be properly trained in the quality aspects of the milk. So this is how we can maintain the proper quality of the milk. What is the importance of maintaining the proper quality also.